According to the World Health Organization, more than 720,000 people die by suicide every year. For each suicide, there are an estimated 20 attempts. In 2021, suicide was the third leading cause of death among 15 to 29-year-olds globally. In the Busoga Sub-region, health workers have reported an increase in suicide attempts registered in health facilities. They say they have observed many suicidal tendencies, and in some cases, these go beyond attempts, resulting in death.
Approximately in a week, we can get like 3 suicidal tendencies admitted and managed. We are lucky that we don't lose so many of these, but they really need care that does not stop at treatment. Generally, mental health, again, when it comes to mental health, there are so many.
And in a community, there are so many people who are there, but they don't know that they are sick. So by the time a person comes here, it's either a person has had an attempt of suicide. That's when the person thinks of, when he has taken like some poison, that's when the patient is brought, and by the time you assess the patient, you find that he had depression, he had some stresses, he lost a child, he lost maybe a spouse.
And about 13 children or pupils in schools have attempted to commit suicide in schools. And about 8 members in the community have also attempted to commit suicide.
Some are also turning to drug and substance abuse, which is worsening the situation.
You find even a child of 9 years on drugs with the adults. Why wouldn't we have now suicide attempts in our community because of that? So we need strong policies in our communities. Also to reach out to those people. There's a street called the Obama Street. They have like a cone, you just find them seated abusing drugs.
And what triggers the people to go the extreme? There could be financial issues. We've seen people getting loans from one bank to another, and they cannot be able to afford to pay. So when they go and get stuff, and the people are demanding for their money, somebody decides to end his or her life. That could be one of the reasons. The other could be social. Social in the aspect that people may be a couple, either intending to trade or introduce, and all of a sudden one of the couple members decides otherwise.
Others are presenting with depression and post-traumatic stress disorder as a result of gender-based violence. Cases of defilement and sexual harassment are said to be leaving many young girls traumatized.
The class that we have now, we are calling it a mental health clinic. The number that we have now is around 120, yes, in our clinic. But that does not mean that everybody is in that clinic. There are so many outside there that are still not enrolled in our clinic. We have the health workers who are also depressed. Actually, depression, anybody can suffer from depression. And I can show you there are some health workers that are depressed. There are some health workers that are misusing drugs.
However, with a rising number of cases, there is now shortage of medicine and limited capacity to manage mental health conditions in some health facilities.